That's what public health was founded on, actually. Public health, the very roots of it was focused around making Black people well enough to work and keeping diseases out of white communities. That is the foundation of public health in America. So yes, Black death is profitable in the US. Our illness, our sickness is profitable in the US.
My name is Fana Asfa, and after doing the backbreaking work to save and reclaim my own life, my passion now is to help others do the same. Since writing my debut book, Sober Daughter, the amount of people that wanted more inspired me to create this podcast. This space is for both real people and industry professionals to share inspiring experiences and usable tools for us all to connect and heal ourselves together. In today's episode, we'll be discussing equity in health and healing with AyeNay Abye and Danisha Jefferson Abye. Remember, stay tuned to the end for some amazing tools to take with you. Today's guests run the Tubman Health Center for Freedom, which addresses health and wellness from both systemic and clinical approaches. By practicing medicine from the intersection of health and freedom, they address both the health of their patients as well as outside factors that can determine their health. Tubman Health provides primary and preventative care, community resources, social services, political education, and advocacy, all in one. Brilliant. I'm so happy to have you both here. AyeNay and Danisha, how you doing?
We're doing great.
Yes, thanks for having us.
I'm so happy to have you here. There's a little secret. Should we let everybody in on the little secret?
Yeah.
AyeNay and I are cousins.
Yes. So I'm even more thrilled to be here and see your smiley face. Always pleasure to spend time with you. And I just really appreciate your work. So thanks for having us.
I mean, I've been trying to get these two on here and it's like herding cats. They're so busy, but I'm so excited because one, I get to hype up the Tubman Health Center, and two, you guys have such an amazing legacy already of so much advocacy work, so much connection into healing and health, and I want people to know about it. And I want other people, especially women, Black and Brown and Indigenous women, women of color, to have these conversations, right? We really need to have these health conversations. So let's bring it all the way back.
Yeah.
What do you think that brought you from your advocacy work into healthcare? And what was kind of like a healing catalyst that happened? Because I know of some, but I don't want to share all the tea. So tell me what was a poignant healing time for you guys that kind of led you in this direction?
Yeah. I frequently say like my whole life prepared me for this job or what we're doing now. We were both organizers. We worked on a lot of national health justice campaigns. That's how we met, actually. And we're married. So that's we have the same last name because we're married. But we met in the working on health justice campaigns on a particular project. But I have over 30 years organizing experience, primarily around health justice issues that have taken me all over the country. I would take breaks from organizing because that work people oftentimes burn out from. And so over the course of 30 years, I took many breaks and I would go back into private practice. So I also was a manual therapist that worked with folks primarily on reproductive issues. And I had a unique practice that I was in. It was collaborative care. We really worked collectively. I was the only manual therapist working alongside acupuncturists, reproductive endocrinologists, OBs. And really what I heard from patients was that was the type of medicine they wanted. They wanted, medicine that they could relate to, medicine that was familiar to them, maybe passed down from family members, and where their providers could understand each other and not discredit one another. So I kind of married the two. I married the organizing, I married the direct patient care, and decided I was going to launch the Tubman Center for Health and Freedom. But it wasn't an immediate process. It was another 10 years in the works from that point. But, had many familial experiences along the way as well. I lost my grandmother due to medical neglect and poor medical care. I lost my father due to poor medical care. I lost my uncle due to poor medical care. And this is all too well-known story for Black people in America.
Mm-hmm.
Yeah, like while Danisha's over here dreaming of these things, this is the time period in which, we met. And I was living in Washington, DC at the time. And so during that period, I was doing national organizing work for health justice, but I wasn't doing anything with direct clinical care, nothing around like healthcare delivery systems, more about like what healthy environments, neighborhoods, community organizing work, food justice, land use, a variety of things. But during that time, I too lost people in my family, including my dad, my sister-in-law, your mom, people in my foundational understanding of self. Those people are my home.
Mm-hmm.
So I stopped doing community organizing work because I was like, I can barely wake up. I can't be out here in these streets like this and like I used to. I can barely show up for myself. And so I kind of transitioned out of organizing work and I took a job at a university here in Seattle because I was like, I want to be able to take care of myself and focus on that. And so that's very much part of like what our relationship was also based on, was like me slowing down in my life, us really thinking about what a future looks like for us. I moved cross country to Seattle, and over here listening to Danisha every day talking about this dream she has, but also it resonated with me. It resonates with my family. It resonates here in Seattle with communities here. And so when 2020 hit and we started the Tubman Center for Health and Freedom, for me, it was a no-brainer to sign back up. I'm calling it sign back up to get back into, I never really left community work, but to this level and to this scale of advocacy, of organizing, of really making impact around what community solutions deserve.
Absolutely. And the two of you just blended and just came together so beautifully. It was just like, I don't think anybody else could have done it, honestly. It's just to watch you guys and to see it come to life. And it's like the combination of both your, backgrounds and passions. It's really, really, really powerful. And I like, AyeNay, that you talk about, and both Danisha, you guys talked about the grief and the life challenges that happen along the way that kind of like shift our path a little bit. And for me, that's what brought me to this healing work. Was you guys both know how affected I was by my mom. That just made it so much more clear to me that this was my purpose, was to really walk through that and show other people how we can walk through, grief and healing and really change all that's around us. Like you talk about the community and where I like physically had to change where I lived and what I ate and where I was and how I communicated and what I put in my body. And that's so much of what Tubman Health is talking about. And so tell me about, because I think it's so brilliant that you guys are looking at the holistic approach, including the lived experience and the environment and, the structural and systemic issues that people are facing, especially Black people. And so how did that one go over? Like, how was that selling that and kind of getting people on board? And then two, how does that look for people when they come in? Because some of them have never seen, the continuum of care, and that kind of level of access is really, really huge.
Yeah.
Go ahead.
I'm going to answer from my area. So my background is also, I have a master's in public administration. And so just look at public sector data, information, public sector institutions. My experience with healthcare systems was always from a place, and of healthcare institutions was always from a place of like knowing what the institutional knowledge was about our communities. So it's like, oh, Black people are dying. These 30 different ways. Always constant. Oh, Black people are most impacted, and the disparities, whether on education, health. I mean, I knew all that stuff. It constantly am told about it.
I think we all are, right?
Exactly.
That's
And
the
so,
story.
yeah. So the chance to ask people, Black people in particular, how are you living,
Mm-hmm.
was like a light switched on. And because the societal gaze on like Black bodied people is so toxic, you know, there's something about asking really people who look like you, hey, what are you doing to live?
Yeah.
That created a whole energy and a dynamic within our organization and our organizing principles where we said, we're not going to perpetuate white supremacy.
Mm-hmm.
And so we got to ask, how are you getting free? And how do we do this to scale? Just asking that question from the beginning allowed me to also see the commonalities between communal groups.
Mhm.
So because we're Black and Indigenous founded, led and serving, you know, for us, the biggest thing I've also learned too is when you center people at the margins, you realize too that this is actually a dream of so many people.
Yeah. Mhm.
That what we're asking for and what we want, it resonates across age, across race. It's like we're like tapping into just, I feel like just what fundamental care is.
Yeah, yeah. And we know we have decades of public health data that tells us 80 to 90% of people's health is actually determined by their social conditions. Like, this is not new information. We know this, we have data to support it. It's all there. But
Yeah.
yet you look at the institutions that are then in place to address people's health, and they're not doing that work in many cases, in many instances. That is not what's being addressed. They're sticking Band-Aids on people and sending them right back out the door to exist under these racist structures that continue to make us sick. And so and there's like buzzwords around culturally appropriate care, you know, if people really wanted to address and utilize culturally appropriate care, they would be addressing the systems that are making us sick in the first place. And so we decided,
Absolutely.
right? So we decided early on that's what we were going to do.
And it blows my mind that this is where we're at, you know, that's been this long, obviously. But when you talk about bringing it back to so many, this was like ancient healing. And this is just like traditional. We look at the whole person and the story and the life and where they are and what's going on and why are you crying and who passed away and all of that.
Yeah.
And I think what you guys are saying is it's you guys are leading the fight because it's always Black women and you know and indigenous and people that are from these, you know, they can tap into those ancient systems, but all the new age, all the rage, all the thing is, you know, looking at healthcare now, looking at how do I get well now, and realizing that the general Western medical system just does not work and it makes you sick. And this country is built on making you sick, and there's profit in that. And there's, you know, this systemic thing of just keeping people so unwell.
Yes.
Yes.
So unwell.
And that's what public health was founded on, actually. So public health, the very roots of it was focused around making Black people well enough to work and keeping diseases out of white communities. That is the foundation of public health in America. So yes, Black death is profitable in the US. Our illness, our sickness is profitable in the US. And most people go into healthcare with great dreams and desires and want to do well and want to change things. And guess what? Many of those people end up sick as well. Healthcare providers are also disappointed with how the healthcare systems are working. You know, we run into folks on all levels of government, healthcare institutional leadership, all kinds of folks. Everyone knows the system is not working. It's something, it's fundamentally agreed upon. And so rather than tinkering, the Tubman Center for Health and Freedom has flipped it completely on its head, and we're reimagining from the ground up.
And I love it. And it's paving the way for so many others. And, you know, like in my field in recovery, there is a huge problem happening with these big corporations, you know, buying out these treatment centers and treatment facilities. And so once again, we're starting to look at, you know, these band-aids instead of the root of the issue, which is a full story of how did you get here? How did you get here, and how is now this blown, you know, manifested into addiction? And how can you tangibly take what you're learning into your environment, right? So there's this huge disconnect of like, we're just going to keep putting bodies in the bed and then shove them out the door at 30 days and be like, oh, they didn't stay sober. There's no way. And it's because there's so much profit in that.
Yeah.
Yeah.
Exactly. I think that's one of the things that we've also been organizing around and making new arrangements is just around our independence. Like in your field in primary care, like, yeah, everything gets absorbed and clinics don't get to stay independent.
Yeah.
You know, but also not only being a Black-led institution, but to open an independent healthcare facilities unheard of today because of all the corporate mergers and takeovers in the health field, again, because it is a very profitable industry because, again, our communal death and dying is profitable in America.
Right.
And we all agree that shouldn't be the case. So to then start healthy businesses for health and well-being in itself is also a victory. And to also say we're not the first and we're not the last. We just say this is our leg of the race. Communities and people like yourself and your parents, you know, have been fighting on these issues for decades, centuries here in America, right? And so this is just what we say is like our leg of the race of it. And to be those reminders to people like, yeah, your self-determination is like really about like, you cannot control our bodies, right? Which also means corporations cannot control what our care looks like.
That part. And that you guys are up and not only, you know, able to do it, you guys are thriving. And there's a huge, I know I see all of your work that you guys put out, and there's such a huge community response. And it must feel so incredible to feel finally seen. You know, that feeling of like, oh wow, this is like looking within and actually caring about me. And in recovery, that changes the game. If you have personal direction, meaning if you have an invested stake in your recovery because you can connect to it, you believe it's actually attainable, you believe that there's a future for you, your success rate is through the roof.
Right.
But if you can't see anybody like you, or you don't connect to it, or, you know, it's just the barriers. So what do you think are some barriers that you guys see, especially women facing right now in healing and in their health? Where are they getting stuck that you guys are trying to give some kind of, you know, legway for that?
Well, you know, it's interesting. The narrative has changed. The story has changed over the past, I don't know, 20 years that I've been doing specifically work around healthcare reform. So 20 years ago, we were saying people needed insurance. People had insurance, things would be better. Yes, that's true.
Yeah.
That's true. Yes, we need insurance.
Yeah.
But and then there, you know, there was a narrative around, oh, this is, you know, just low income women. Low income women have a hard time with access and, you know, making their appointments, and, you know, access is a huge issue for low income women. And so, you know, time has passed, we've gathered more data, policy changes have enacted. We know now that socioeconomic income level does not determine one's health amongst Black women. Black women of high income wealth are still facing many of the same challenges you would find regardless of socioeconomic status. We also know insurance is not saving the day. We know folks who have insurance who still can't find providers, primary care providers, as you mentioned, like finding someone that they can relate to. And this narrative around access, it's like we have to ask ourselves, access to what exactly? What access
Right.
to crappy care with providers that cannot relate?
Yeah.
Many would argue is just as useless as not having insurance in the first place. So yeah, I would say now, it's finding trusted providers is a huge sticking point for folks. It's hard to find trusted providers. It's hard to find folks who will practice the type of medicine that we want and need. We did kind of our inaugural study was called Well Us, and it's a long acronym, I'll spare you, but the basis of the study was really asking marginalized community members, how do you care for yourselves, and how do you maintain your health and take care of those you care for? And 100% of respondents in that study said that they use some form of what's considered complementary and alternative medicine. And we've asked people about accessing complementary and alternative medicine, and folks say, cost is a huge issue there. Insurance companies might say that they are covering these modalities when in actuality they don't, or it's really limited. There's a lot of fine print on how they can actually access them. Or when they go and they talk to their primary care provider about accessing those kind of medicines or utilizing that medicine, that they're dismissed or made fun of. And so I feel like those are kind of some of the main sticking points that we've heard from people. Yeah.
So many, and those barriers are not just, that the data keeps kind of trying to say one thing, and that's just there's systemic racism. And there's this, ingrained unwellness, that there's no benefit to your wellness in the structure. And so it's almost like you have to go out of the box now to really get what you need. That's what I love about the work that I do and this podcast, is that, when AyeNay knows, when I went to treatment and I saw all those people and all those clinicians and all this help, I said, what the hell is this? I didn't know. I never been to a therapist. I never been equine therapy, or what is this? All these modalities. And, I had to sell my mother's house so I could go to treatment. And who can do that? And I had to sell the house to get well, right? If that's the experience for, these upper echelon exclusive, what are we getting?
Right.
What are we tapping into here?
Right. And before all of that too, all the things you had to do to either navigate or not enter the arena of wellness. So I resonate with that a lot, because I'm like, so many, even if you have the skills, the ability, you speak English, you're a great oral and written communicator, you know where these facilities are, you have a car, you have everything, and yet you still can't go.
Right.
And you have an asset to leverage to then go do X, Y, or Z, and it's still not working for you. So it's like, that's the biggest thing for me that, to your point, has really pissed me off, because I'm like, I feel very capable to do a lot of things. And knowing how rigged the system is on purpose, or a Fauna, a Danisha, an AyeNay, all the people watching this to not succeed. You do that on purpose. That's where the advocacy work comes in, and what moves me about this work, because I'm like, it's not like they don't know. It's set up that way. And so, like, wow, you really are just burning us all out and just trying to navigate basic care. And you do that on purpose. That's the part that keeps me just moving along. And to your point, doing my own personal work outside of those mainstream systems. Because they're making me sick. So you got to go find the places that will get you well, keep you well, and make And that's within your communal networks.
Yes,
Your
100
communal networks.
communal networks.
Yeah, and to not honor communal networks, to not support and uplift solutions that are doing well within communal network. You can't have successful communal.
Isolate you from your.
Yeah, in the mind of corporate dominance, the communal network is the thing that they're like, oh, how do we monetize that?
Yeah.
That is the benefit I do feel that the people have, networks you're creating have, that a corporation can't ever get to,
Never.
can't touch it.
It
So
can't exist in that structure.
Yeah.
It can't. They're completely
yeah,
operable together.
yeah. So Tubman Health will never be a Seattle Children's Hospital. That will take us then away from our communal networks. We exist and we thrive because we're an accountable health institution that's rooted in communal network.
Yep, I love it. And it translates so much, you know, for anybody who's in recovery and working through trauma and grief and healing is, you know, the one thing in recovery I try until I'm blue in the face is build a community around you of people that you see navigating things that you thought were impossible. And for me, and the reason it's called Sober Daughter Podcast is not because everybody on here is sober. It's because that was my door to freedom. That was my door to, oh, maybe I can change my diet. And now I'm not like taking in all this poison to numb me out and to kill my heart and spirit and disconnect me from my ancestors and disconnect me from my reason to be. Like, I think it's so radical. I think it's a F you.
That's right, baby.
Yeah, it's a big F you to be sober and to start looking at how can I take care of myself within my community and looking at other people that look like you or align with you and your values that can help, because the big pharma, the big systems, the last thing on their mind is our wellness.
Yeah. And I think it also that it makes it so the individual is not the anomaly, right? Like the thing that drives people into addiction, the thing that drives people into diabetes, these things are oftentimes systemic in nature. If we keep peeling back the layers, there are systems in place that are driving our illness. And when we join a community, when we build a community, when we're part of a community, we can see our reflection in others. We can see how, wow, yeah, it's the system. It's no longer just the individual who has an issue. It's the system does. And I think that's what's powerful about community organizing, right? I often say organizing saved my life. I know AyeNay has said something similar, you know, being able to be a part of a community with a goal in mind and being able to make it less of an individualized issue. It's a communal issue. The systems are what needs work. The systems are what needs changing. So joining a community and actually organizing for health and freedom.
Good plug.
It can,
Good job.
can improve health and save lives.
Truly. I think the work that you guys are doing is just going to translate in so many far reaches, because it's what we need and what people are desperate for. I mean, it really is. I see it over and over and over again that, you know, this idea that, like you said, you know, pull yourselves up by your bootstraps, the individual, you know, the concept that we're all doing this alone is making us sicker and sicker, and we cannot heal alone. And the more, you know, people share what they're learning and give it back, it gives us that much more chance to unchain ourselves from a system that just doesn't have our best interests at heart. So
absolutely,
that's right.
I love y'all.
Thanks for having us.
Thank you so much, you guys. I think everybody has some huge takeaways, especially to empower themselves, to check in with themselves, and they feel reflected around them, and a community around them, and also that you guys are shining the way for care that's actually accessible, that they can, you know, reach out to and have a whole different experience of
Yeah.
health and wellness. It's incredible.
Yes, thank you.
Thank you.
If any of you guys want to connect, how do they find access to the Summit Center?
All our handles are at Tubman Health.
Okay.
And then our website is www.tubmanhealth.org. We are based in the Puget Sound and Seattle region, and a lot of our discussion and resource, to your point, resonates with communities across the country. So tap in, let's talk online, and if you're in the Puget Sound region, come through.
Yeah. Well, thanks everybody for joining in on today's episode of Sober Daughter Podcast. Be sure to check back next week where we're going to have another incredible guest sharing their usable tools, experiences, and expertise to help us all heal and empower ourselves together. And if you want to follow me, please follow at Fauna on all socials, see what the hell I'm up to. And if you want to ask a question or send in any info on a next upcoming episode, follow at Sober Daughter Podcast on all socials. Thanks again, and remember, keep doing the good work.